In this presentation, I'm going to be highlighting one of the key concepts of the course, which is asking the question, what is the impact of religion on health? And if you ask most people, they would probably jump to the negative and they talk about something like a religious sect that doesn't allow for blood transfusions and so on. But it turns out the opposite is in fact true, and there's a growing body of research that is showing this definitively now, that actually, in general, religious people live longer and they're healthier. So this, of course, is a very important finding, and we need to dig into why this would be across religious traditions. So I'm showing a picture here from an African American Baptist church, and this is a very good example of the way these things intersect. And so we know now that the churches in the United States, particularly the African American churches, have functioned in many ways to foster the health of their congregation. One way is in fostering political organizing, and so we might say, what's the connection between that and health? Well, they lobby for things like public health care. So we can't disentangle these various threads. The church has also often directly intersected with health through offering clinics at churches, so where healthcare professionals take blood pressure and do basic checkups. And also churches, and this isn't obviously just African American churches, often look after the health of their congregants by doing very practical things like arranging appointments and driving people to their appointments and so on. This article by Brian Bethune, who often writes on religion, was published in 2015 in Maclean's, and it's deliberately provocative, and you probably won't be surprised to know that the comments were quite something. I read through them, and as somebody who teaches in religious studies, they weren't surprising to me. So people were extremely hostile in reaction to this article. And I think some of you may have already experienced this, even when people say, what course are you taking? You say, I'm taking a religious studies course, and people often have a very negative reaction. So the title of the article is "The Science is in, Jesus Saves, Seriously," and then in the small print there it says, "So do Muhammad, Yahweh, Buddha, and Vishnu." So this is one of the first mainstream articles I had read on this topic, so it's taking a very long time for the sort of scientific academic research to make it into the mainstream, but this article certainly started an immediate conversation. The Maclean's article was based on the findings of psychologist Lisa Miller, who is a professor of psychology and education at Columbia University in New York. And she recounts in the article the way that her research has often been received with incredulity and hostility. But she has prevailed, and she's written a book called The Spiritual Child. She's particularly interested in the psychological health of children and teens. And she herself comes from a practicing Jewish family. So her findings were, as we can see here, I'm sorry this is a little bit blurry, but that religious children are 40% less likely to abuse alcohol or other drugs as a teen. They're 60% less likely to suffer from depression. They're 70% less likely to move from substance dabbling to substance abuse. And as you can see, as indicated by the photographs here, it doesn't matter what the religious tradition is. They all have this impact on basic psychological health. A very important publication in the field of health, healing, and religion is the book God, Faith, and Health by MD Jeff Levin. And he started out in his graduate work looking at the connection between spirituality and health. And his work has had particular impact because he used a vast amount of data. And so he looked at surveys taken by the National Institutes of Health in the United States, so thousands and thousands of people. And he began to look at the connection between religion and greater health and longevity. So he's quick to caution there's no guarantee of such a benefit for any individual. So he's basing this obviously on averages, not that being religious guarantees every single person good health. So as a graduate student, as I mentioned, his professor directed him to begin to look at these health surveys And after 4.5 years of research, he had looked at 200 peer-reviewed articles, and this resulted in a thesis and article called "Is There a Religious Factor in Health?" And he noticed an immediate pushback by other MDs regarding his research. Levin has since developed the whole field of the epidemiology of religion, which is the study of factors that promote health and prevent illness. And so he's arguing that religion should be placed alongside other determinants of health. A number of you will probably be familiar with the idea of the social determinants of health. So Levin and many others now are arguing that this should also include religion. And he states that religion needs to be factored into health just the way doctors advise their patients not to smoke and maintain a healthy weight. Now, part of the challenge to this, as he notes in the book, is that MDs reacted immediately to his findings, and one of them said, "This is the sort of thing I wouldn't believe even if it were true." Now, this is a very interesting statement. So when you hear somebody saying like this, we know we're in the area of ideology. So we're in a space where somebody's beliefs are not necessarily related to the actual facts. They're related to just their belief systems. And so this is often what we come up against in this field. So it becomes very important to have the data to show to people who react in this manner. MD Larry Dossey writes the preface to Levin's book, and he writes, "Most people outside of medicine take for granted the idea that religious practices such as worship, prayer, and meditation are important for their health, and they often wonder what all the fuss over these issues is all about. But the fact is, unfortunately, that medical science has long looked with disdain on the possibility of a spiritual factor in health." And so when we get to the section on biomedicine, I'm going to be looking at a number of the historical reasons for this, and we'll have a discussion regarding whether this is starting to shift and change. So some of the direct ways in which religion impacts upon health, according to Levin, are that they shape attitudes and offer solace and a sense of intrinsic trust and optimism. So many of you will probably know religious or spiritual people, and that when they face trials and tribulations, as everybody does, they will often say something like, it's God's will, or this is all part of the plan, and etc. So this idea that there's a meaning behind what happens to us in our lives. Also, religions offer practices such as prayer, meditation, contemplation, recitation, that we now know, according to many, many studies, calm both the body and the mind. Religions also foster reverence for the human body. It's often seen as sacred, a temple, a gift from the ancestors. So in Christianity, for example, we often hear the body referred to as a temple for the spirit. In Chinese traditions like Confucianism, the body is felt to be a gift from one's parents and ancestors, and to harm it is to disrespect one's family. You'll probably know that in traditions like Judaism and Christianity, suicide is considered to be a form of going against religious law. So religions then function as a strong sanction for better health practices. As Levin states, no major religion encourages sloth, promiscuity, drunkenness, drug abuse, and obesity. So this becomes particularly relevant in the Western world, where it's estimated that 50% of the diseases impacting people now are related to behavior and lifestyle rather than lack of food or water or infectious disease. Another absolutely vital way in which religious traditions impact health is that they foster community. And so across a wide variety of religions, we see this, the idea of congregational worship, so the idea of gathering as a group. Within Islam, the idea of the worldwide community called the Ummah, and in Buddhism, the Sangha. So the picture I'm showing here is of the monks lining up to get alms from a devout Buddhist. She's giving food to these monks. And so the idea of the Sangha in Buddhism is the community of the monks and nuns, but also the direct link between them and the larger community. And so we know psychologically for human beings, we're social in our nature. And so the idea of being part of a group in and of itself is healing. I want to end this presentation by emphasizing a point that I think is often overlooked which is the fact that religions are holistic systems. So we can make bullet points and say these are the factors, but it's in fact the way that they all work together that really makes a difference. That said, even taking parts of it, so we're seeing this increasingly that secular psychologists are using techniques taken from Buddhist meditation. They still are very effective, but really religions function as overarching holistic systems. So just to give one example, the 8 limbs of yoga addresses all aspects of the person, the physical, the mental, the spiritual, etc. So it becomes a little bit dubious to just start trying to take out little pieces of it and think that that's going to really dramatically affect health. But as I said, it's still better than nothing. And so we'll be talking this as we move through the course, the ways in which, even in a secular setting, some of these practices can be taken up and used to help foster health.